And hi, everyone, and welcome. My name is Alejandra Marquez. I am so glad you are joining us for another important session in our Type 1 diabetes screening series. At Diabetes Sister, and today's webinar title is What is Like to Screen Positive for Type 1 Diabetes? A Real Life Perspective. At Diabetes Sister, our mission is to support and empower women living with and at risk for all types of diabetes through education, resources, and community. Today's topic is deeply personal and often emotional. Screening positive for type 1 diabetes can bring more questions than answers. And it's completely normal to feel uncertain about what comes next. Our goal today is to help you understand both the medical and emotional sides of that experience, what monitoring looks like, what it means, and how to navigate this in between stage with knowledge and confidence. We are honored to be joined by Dr. Victoria Bouhairie. Thank you, Dr. Victoria, for being here. She's a board-certified endocrinologist in endocrinology, diabetes, and metabolism, as well as in lifestyle medicine. Dr. Bouhairie is the founder and CEO of Perry Wellness in Diabetes Center in Charlotte, North Carolina, and serves as a board member of Diabetes Sisters. She's dedicated to improving healthcare outcomes, advancing early screening efforts, and empower patients through education and advocacy. Thank you, Dr. Victoria, for being here. And also, we are joined today by Tonya McNeil. Hi, Tonya.
Hi.
We will be sharing her life experience after screening positive for type 1 diabetes. Tonya's story offers a first-hand look at what the monitoring phase is really like, from the emotion to the practical day-to-day step of staying proactive and hopeful. Before we begin, just welcome everybody who just connect. Just a quick housekeeping note. Please use the Q&A box to submit your question at any time. We will address as many as possible near the end of today's session. This webinar is being recorded and the replay will be available soon at diabetessister.org. And most importantly, this is a safe and supportive space, so feel free to listen in, reflect, and connect in whatever way feels right for you and make questions. It's the time. Once again, thank you for spending part of your Saturday afternoon with us. Now it's my pleasure to welcome Dr. Bouhairie, who will begin by explaining what it means to screening positive for type 1 diabetes and what is the next step typically involved. Thank you, Dr. Victoria. It's all to you.
Thank you. Thank you for that introduction. Yeah, we're going to have an overview of the screening process as well as type 1 diabetes. And then as Alejandro mentioned during the Q&A session at the end, please feel free to ask all the questions that you may have. All right, so let's get started. Let's talk about what type 1 diabetes is. And this is an autoimmune condition. And essentially what that means is your body essentially, the autoimmunity part means that your body essentially is attacking itself. So when it comes to type 1 diabetes, it is attacking an organ called the pancreas. And the reason why this is important is because the pancreas has what's called beta cells, and these beta cells produce insulin, and insulin is needed to regulate blood sugar levels. So without insulin, you have too much sugar or glucose within the bloodstream, and that can cause major complications, including what's called diabetic ketoacidosis. Living with type 1 diabetes is a struggle, and that truly goes without saying. There are many things that you have to think about, from constant monitoring of your blood sugar levels, be it through a finger stick or continuous glucose monitoring, The need for that team support, healthcare team from primary care, if you have endocrinologists, psychologists, insurance, etc. There's truly a team that you need, a team that you need to trust also. What to do around exercising, what to do with your meals, how do proteins affect you, how do carbohydrates affect you. Knowing that not one shoe fits all, each person is different in terms of what different foods can do. It has emotional struggles. There's a lot of what we call diabetes distress, as well as just overall depression in those living with diabetes. And of course, insulin use. And the use of insulin is tied in with your insurance company and which insulin is covered, as well as how you give yourself insulin. Is it going to be multiple injections? Is it going to be a pump? So living with diabetes, there's a lot of demand that occurs on a daily basis. When it comes to the risk of developing type 1 diabetes, what we do know that is if you have a family history of type 1, there is an increased risk of having type 1 diabetes. And some studies even show family history of any autoimmune condition also increases your risk of type 1. But if you have both parents with diabetes, you have a 30% risk of developing type 1. And that's both parents with type 1, not type 2, but type 1 diabetes. A father confers a higher risk than a mother in terms of developing type 1 diabetes. But it's also very important to realize that over 85% of people who are actually diagnosed with type 1 do not have a family history of the disease. And 40% of people develop what I mentioned earlier, diabetic ketoacidosis, and this is a life-threatening condition. So we have 40% of people that actually are diagnosed in diabetic ketoacidosis at the time of diagnosis of type 1. What we now know is that there are three stages when it comes to type 1 diabetes. Initially, what we tend to see is at stage 3, where you have the clinical signs as well as the elevated blood sugar levels. But we know that there is a stage 1 as well as stage 2 that can develop months to years before stage 3 it develops. And the difference is that with all the three stages, you have the presence of these autoantibodies. And these autoantibodies are proteins that essentially signal the destruction of those beta cells that I talked about initially. So the presence of two or more autoantibodies gives you a diagnosis of type 1 diabetes. In stage 1, you do not have any clinical signs, and your blood sugars are essentially normal. And in stage 2, you have elevated blood sugar levels, not as high as what we tend to diagnose typical diabetes, so a mild elevation of your blood sugar levels and no clinical signs. And then, as I mentioned, in stage 3, you have both the clinical signs as well as the elevated blood sugar levels. And right now, we're quite fortunate that we can detect type 1 diabetes earlier. So again, if you remember, I mentioned that typically we diagnose it at stage 3, but now we have the ability to identify individuals who might be in stage 1 or in stage 2. So the importance of this is, number one, if you identify earlier, stage 1 or stage 2, we're actually able to prevent hospitalizations as well as DKA. Studies have shown that that risk of DKA that I mentioned prior, which is 40% at the onset of diabetes, when we typically diagnose people with diabetes, that risk decreases down to less than 5% if you're screened earlier. We're also able to prevent hospitalizations because when you have your healthcare team around you, they give you the tools and resources and able to be to monitor your blood sugar levels so you're able to identify those highs before it gets to severe levels, which will require hospitalization. You also have time to be prepared. So if you're in stage 1 or in stage 2, you have time to know what technology you want to use. If you want to use continuous glucose monitoring, if you want to use a pump, you have time to talk to your insurer and see what's covered. You have time to assess the different resources that are available to you, your healthcare teams, And then you also have the ability to undergo clinical trials. There are different places that this can happen, from TrialNet, etc., or even the ASK program, where they have the ability to bring you into some trials that you can potentially participate in. And then there's early treatment. Teplizumab is one of the medications that is one medication that has come out, and at this point, really the only medication in November 2022 that has been able to prevent or delay the onset of stage 3 type 1 diabetes for about 24 months. So when we think about what the screening involved, right? So how do we even detect type 1 earlier? The screening that is involved requires the use of blood testing. And what we want to do is to identify these antibodies that you see here. And the American Diabetes Association recommends that we screen for these 4 antibodies. And these, you can do this by a blood test, similar to when you go to a lab where they'll do a venous stick, or a finger stick. And that can be done with your primary care, or it can be done at home with a home kit. So this slide here breaks down the ways in which you can be screened, and by no means is this a fully exclusive list. There are many other ways. Some of the ways include a research-based screening program. So the Ask and TrialNet are 2 examples of that. You can also have a state-based screening program. And some of these will actually screen at newborns from newborn screening blood work. So that's Cascade and Pledge. Enabled by Biosciences is a way in which you can be screened, in which your healthcare provider actually requests the kit from this organization. They mail it to your healthcare provider, and then they will provide that screening kit for you. And then you have the typical way in which you do your annual labs, meaning your healthcare provider will order labs, and then you go to either LabCorp, Mayo, or Quest, or whatever lab company that you use, and then you can get a blood drawn there. So what happens if you screen positive? And, again, this is one of those things where it's not one size fits all. Your entire picture will be taken into consideration, right? But for the most part, we definitely will confirm. So if you have one positive test, we will want to confirm that this is indeed positive with another test. And if the second test shows that you're positive, then you'll be staged as a stage 1, as a stage 2, of course, is a stage 3. We would want to monitor you regularly. So in the stage 1 and stage 2 diagnoses, you might get a continuous glucose monitor or finger sticks, whichever you prefer. And again, that's where you'll really get that knowledge, where you talk to your professionals, you get referred to a specialist if needed. And then you can consider all these alternative treatments. The Teplizumab that I mentioned, currently indicated for stage 2 type 1 diabetes for anyone who is age 8 and above. And then you can be prepared for any emergency. So you'll get education. Should your blood sugars go up, what you need to do, the prevention of diabetic ketoacidosis, how to use insulin if you choose a pump, how to use the pump, and different things that can occur with the pump, and what to do if the pump isn't working. All those useful things that you need, which you'll need to have once you have the full-blown stage 3 type 1 diabetes. And again, the ability to undergo research opportunities. So you get to see what research opportunities are available to you depending on the stage, your age, etc. So this slide just talks about briefly Teplizumab. As I mentioned before, it was FDA approved in November of 2022 as the first medication to delay the onset of stage 3 type 1 diabetes. DiabetesSisters.org has a lot of information. So going to the website, you'll see different webinars that are there. You'll see PDF forms that gives you a vast amount of information. And thank you for being here because truly educating yourself truly does empower you, give you the knowledge, etc., for you to, if it's for you, if it's for a loved one, truly gives you that knowledge in order for you to take care and empower yourself. Um, Going on into again with a website, multiple things available for you for resources. There's downloads. You can get access also to the other programs that I mentioned. So Ask Program, you can find that website there, TrialNet, etc. And again, different downloadable resources are available at diabetessisters.org.